today's
Recording in progress.
I know it's Sunday and we have engaged you here, but I feel blessed, because not only Dr. Usha, Dr. Chavi, Dr. Hardik, everyone, whenever we request to come forward to help our users in understanding any particular clinical issues, they are always very excited to join us. Thank you so much, ma'am, and good morning. Thank you
Good
for
morning. Thank you, Neha, for introducing, and good morning, everyone, on this Sunday.
I think I'm going to give you the spotlight so that everyone can, hear Dr. Usha clearly. Ma'am, if you can just tilt your laptop a bit, we can see you clearly.
Pardon?
If you can just tilt your camera or the laptop a bit, the screen, we can see you more clearly right
Is
now.
this okay?
Yeah, it's perfect now. Yes,
Oh.
perfect, ma'am. Yes. So you want me to share the presentation or you will be doing?
Yeah, you can share the presentation. You can share the presentation.
Done. So, ma'am, it's a like World Antibiotic Awareness Week. Very few people are aware about it. Very few people, do any webinars or address these issues. What do you think about it? Do you think people should be aware about antibiotics? They should know what are actually antibiotics and when and how to take it?
Yes, definitely, definitely. Antibiotic resistance is a global problem. There are a lot of resistance we see in our clinical practice because, especially in India, antibiotics are given over the counter, just 1 or 2 tablets, and all these things, and that causes a major resistance and makes difficult treating the infections. And as we explain, as I go through the slides, I'll be telling more on that.
Exactly. And if you are aware, once. Okay. So as you are aware, as Dr. Usha said, definitely we have to be aware about lot of concepts about antibiotics, but apart from that, also it impacts your nutrition also. So once you are on antibiotics, after that, there are a lot of deficiencies in the nutrition, which I will be taking care of. But before that, Dr. Usha will be briefing you about the entire antibiotics, what are the pros, cons, and what precautions one should take when they are on antibiotics. Let me know if you are all able to see my screen. Ma'am, is it visible to you?
Yeah, it is visible.
Okay, we can start now.
Oh. So good morning, everyone, once again. So on this event of World Antibiotic Awareness Week, I'll be telling you a few important points which everyone should know about antibiotics. Okay, so I'll be mainly speaking about the antibiotic resistance. Okay, so Neha, next slide. So first of all, we should know what are antibiotics. I'm sure that most of us know what are antibiotics. These are medications that are used to treat bacterial infections. The most common conditions commonly where antibiotics are used are in bacterial pneumonia, tuberculosis, urinary tract infections, most common. But also, we should know one more important thing that we commonly see, frequently see every week, every month, every family member, one or the other will be having flu, common cold, all these common problems. But these are most of the time viral, and antibiotics are not needed in this situation. Now, what is antibiotic resistance? Antibiotic resistance is a natural process that occurs when the bacteria change their genetic nature and they no longer respond to the antibiotics which are used to kill them and prevent infection. Now, how does this antibiotic resistance happens? Most of the time, it is overuse or misuse of antibiotics. Like when taking antibiotics when it is not needed, or not completing the course of the treatment, inadequate dosages, all these things are most commonly seen, which are responsible for creating antibiotic resistance. So now, why should we know about antibiotic resistance? What is the impact? It is only related to doctors and hospitals? Yes, of course, dealing with antibiotic resistance the responsible people are doctors. But then if that can be supported by the common people, by the society, it makes things easier. Now, the impact of antibiotic resistance is it is a global health threat. It makes harder to treat the infections in the hospitals, especially when people are admitted in ICUs. And it prolongs the hospital stays. It increases the medical costs and it increases the mortality, the death rate. Most of the people in the society may not be knowing what is happening in the ICUs. Only when someone is admitted there, they will get know a few information from the doctors. But most of them may not be knowing also. That is why we conduct this webinar so that the awareness is spread among the people because of the impact it has on the society. Now, what are the precautions for taking antibiotics? First and foremost thing is listen to your medical practitioner. Take antibiotics only when prescribed by a certified healthcare provider. Please follow the instructions regarding the type of the antibiotic, dosage, duration, and these things. Now, even if you feel better, finish the prescribed course. Do not skip the dose or stop it prematurely. We see when patients come for follow-up or for some other reason, when we ask the patients, okay, you had a respiratory infection last week or a urinary infection last week, did you complete the course? Most of them tell, doctor, only 2 tablets, my infection got cleared, so I just stopped it. So that can cause antibiotic resistance. So that is why even if you feel better, they tell we were fine, we stopped. But we tell them, please complete the course of antibiotic. And do not skip any dose or do not stop it prematurely. Now, one more important thing is never self-medicate. Never use someone else's leftover antibiotics or expired antibiotics. And never pressurize the doctor to start an antibiotic for a viral infection. Maybe you may not be knowing that whether it's viral or bacterial, but the doctor will be knowing it. So wait, at least let it come from the doctor's side if antibiotic is needed. Now, one more important thing which we should be aware of using antibiotics, the side effect, or we can take it as a side effect. These antibiotics disrupt the gut bacteria. There are some useful bacteria in the gut. They prevent many infections. What happens is if antibiotics are taken indefinitely or inadequately, they destroy the useful bacteria and the bacteria which causes infection will overgrow and that can cause infection. So in such a situation, when we know that the antibiotic disrupts the gut bacteria, it is better to take a probiotic or fermented foods. Usually yogurt, buttermilk, these are advised when antibiotics are taken. And of course, we also have some probiotics available in the market. And in a person who already knows that taking antibiotic will cause diarrhea, in such people, together with the antibiotic, a probiotic can be prescribed and they can take it. Now, avoiding important, just previous slide. So one more important thing is never increase the dose on your own. Okay. Suppose the infection has not cleared, instead of 1, let me take 2. That will not help. It will cause more side effects. And that increases the risk of resistant bacteria again. Next slide, Neha. So most important side effects of antibiotics are allergy to the antibiotics. This can be life-threatening. It can be in the form of rashes, swelling of the lips, redness in the eye, itching. Some people do have breathing difficulties also, and that becomes life-threatening. So if you have any allergy, please tell your doctor before that, especially to some specific antibiotics like penicillins earlier when they were using, that would cause big complications. Now, even today, we see different people have side effects to different allergy to different antibiotics. If you're already aware of it, please inform your doctor. And suppose you don't know and it has developed for the first time, please, any skin rashes, itching, as I told you, swelling of lips mainly, redness in the eyes, puffiness of face, breathing difficulty, please immediately go to our emergency department. The other little complications, Neha, the previous slide I didn't complete. The other side effects are diarrhea, which is most commonly observed, and that is caused by gut dysbiosis, which we discussed in the previous slide. So that can be taken care of by taking the probiotics. The other complications are heartburn, and this is most commonly observed. Taking a antacid gel or PPIs or a ranitidine, what we commonly call, that can this side effect can be overcome by that. In such a situation, avoid spicy, oily food so that it is not it doesn't increase again. The other complications are nausea, vomiting associated with these antibiotics, palpitations also. Most of the time, once we stop the antibiotic, all these side effects will come down. And if it is really troubling you, you're not able to sit comfortably, especially with palpitations, please contact the immediate emergency or doctor in your neighborhood. And never ignore your side effects. Please inform your doctor if you have any, even using antibiotics frequently, you will come to know few side effects which you can tolerate, like just acidity also. But then the allergy is a really important thing which you have to inform the doctor. So finally, to conclude, I tell that by following these precautions, you can help protect yourself and also others from dangers of antibiotic misuse, and we can prevent so many mortalities, morbidities. The cost can be reduced, hospital stay can be reduced. So it should be used very responsibly for a healthier future. This is what I would like to conclude. Okay. And how antibiotics affect nutrient deficiency, absorption, and all this. Our Neha will be speaking about this.
Thank you, Dr. Usha. Yeah.
Thank
So I
you.
just want to also give you a little brief, but in between, whatever the questions you have for Dr. Usha, please write down in the chat section. But yeah, I will be helping you to understand that what are the nutrient deficiencies one, undergoes, and what are the problems they face. So whenever we are on antibiotics, we, get to see a lot of, you know, side effects on the gut side. So the gut microbiota disruption is, observed. It kills a lot of, harmful bacteria, but side by side, it also kills the and disturbs the gut flora. So we have to be very careful that, even Dr. Usha has mentioned at the beginning that we need to focus on the probiotics so that we can take care of the gut microbiome, because all the digestion, absorption of nutrients is very important when you are going through any health condition. If you're having any sort of infection, it's important to focus on your gut microbiota also. We cannot avoid the antibiotics at that time, but we do, can take precaution and take the additional care by adding the probiotics to the diet. But now there are many other factors that one should take care of. What is the impact? So it's, it actually helps in it actually impacts all the antibiotics. They reduce production of certain vitamins, example like, vitamin K, vitamin B, because they are all which synthesized by the gut microbes. So if your gut microbiota is disturbed, आपका gut work नहीं कर रहा है, in that situation the vitamin K and vitamin B is not getting absorbed. So we are generally, being diabetic, Dr. Chavi or any of the physician, they all add, B complex in our diet, because that is the one thing which gets depleted, because in diabetes again the gut is compromised. So we have to ensure that we are taking care of a good nutritive diet, and during when we are taking the antibiotics, after that and during that time, having more of the vitamin K, biotin, folate rich food will help you in completely replenishing all these nutrients lost. Another important factor that we have observed is that it impairs nutrient absorption. As I said, the health is completely on a toss at that time. Inflammation is very high, gut is compromised. So all the nutrients, whatever the food you are eating, is not getting absorbed by the body, because antibiotics, they actually irritate the gut lining and also affect the body's ability to absorb nutrients. So in such scenario, what all factors we should consider, what all factors we should be aware of, it's really of utmost importance. So the impact is that a lot of inflammation, it is damaging the intestinal lining, which is actually impacting the absorption of nutrients. So how we can take care of it? Taking kombucha, probiotics, thin buttermilk, rasam, having moringa. You can add moringa to your curd, which can help you in replenishing all these nutrient loss and preserving the energy reservoir. So apart from that, there are a lot of deficiencies which are there with the diabetes also. Like as I said, the B complex, it's depleted when you have diabetes. But again, the magnesium is also, whenever you are taking antibiotics, the magnesium depletes, the calcium depletes, the iron level goes down, the zinc goes down, and that's why you feel so weak. So to get a good boost in your energy levels and recover fast, we need to make sure chia seeds, these are very good source of magnesium. You can take chia seeds, you can take moringa powder, you can add probiotics like curd, you can add like a lot of rasam, you can add a lot of like, a lot of herbs in the soup like, basil, thyme, rosemary. These are all, filled with immunity boosting nutrients, which helps you in replenishing all these loss and help you in gaining back your energy levels and recovering and healing as soon as possible. Another important factor that we have seen when we are on antibiotics, that there is an increased excretion of nutrients through the fecal route or the excretory route. So some antibiotics, they can actually increase the loss of nutrients through the urine or the stool. Now what happens is this accelerate the depletion of essential nutrients more speedily. Now it's important to take care of your electrolyte imbalance. What happens, like, due to this, your lot of electrolyte imbalance happens. So to balance your electrolytes, that's why we say stay hydrated. You might have heard doctor telling you multiple times that whenever you are on antibiotics or you are having inflammation, please keep yourself hydrated. So chia seeds water again here helps a lot, adding squeezing lemon to it, making sure a little bit of salt is there so that we can balance our electrolytes. And that's the reason again you feel so dehydrated, become so lusterless, so dull. So these are the important parameters which you should consider whenever you have been put on antibiotics from the day one till next 15 days, because it takes time to regain your health. So make sure you are well hydrated, you are taking electrolytes, all these small nutrients in the diet like chia seeds, moringa, curd, probiotics. Ensure that you are taking care of these aspects so that you don't feel weak, you don't feel lethargic. There are a lot of strategies to mitigate nutrient deficiencies. As I said, probiotics, balanced diet, make sure there's a good amount of proteins in the diet, you are eating a lot of vegetables. If you are not able to digest the raw vegetables, you can take the blanched cooked vegetables, which can again help you in getting all these nutrients back. Make sure you are on, like, you are checking with your doctor and asking, like, whether I need any supplementation for the key nutrients like vitamin K, B complex. Avoid taking antibiotics with calcium or magnesium rich food. So whenever you're taking antibiotics, give some gap in between, and that Dr. Usha will help us in understanding what should be the ideal gap between the antibiotics and the food, because there should not be any interference. It should absorb well, and we can actually utilize them well. So I think we are open for the question and answers. These are the important factors which we wanted you to understand and learn. Dr. Usha, I just want you to address that, the main factor that they should keep in mind, how much gap should be there ideally between the food and the antibiotics so that it can absorb well in the gut.
Before 30 minutes or after finishing the food, within 30 minutes, if they take the antibiotics, that's okay.
Perfect, ma'am. Thank you. So, ma'am, I will be taking up the questions. I guess like there are a lot of questions I will explain at the end in Hindi also, let more people, because there are a lot of people joining in. So I hope if you have any doubt, don't worry. Telugu, we cannot speak, so I'm very sorry. For Telugu sessions, we will ask any of the coach to take it during the Saturday session, so they will explain you. Now, ma'am, there are a couple of things that one question is there. It is necessary to have a nutrient supplement while taking antibiotics.
Yes, it is required because antibiotics disrupts the bacteria, and it also decreases the absorption of certain vitamins and nutrition, as you already explained. So it is always better when we know that the absorption is less. So we usually supplement little extra we give so that minimal at least absorption takes place, and that would be helpful.
Yes. I think I have explained this to you. There is next question by Girdhara sir, that should we take probiotics with antibiotics or completing of antibiotic course? So I think, ma'am, if I'm not wrong, please correct me. It starts from the beginning itself when we are starting with the course, so that we know that these depletion are going to take place and we take care of it from the day one itself.
Yes, especially for people who have sensitive stomach. Some people are able to withstand antibiotics without any PPIs, without any probiotics. So they are okay. That is why we ask, had you taken antibiotic before? Are you comfortable with the antibiotics? And if they're comfortable, yes, fine, no need. Some people are very sensitive, and we start it from the day one. Along with the antibiotics, we start the probiotics.
So sometimes it has also been observed that we have recently got any infection, and again we got relapse. Do we need to take the antibiotics again in that short duration, or what do you suggest in such
Yeah,
instances?
depends. The infections are caused by different bacteria. Suppose now a person had urinary tract infection. I would have treated. After 10 days, he comes back with another bacterial pneumonia. The bacteria would be different. The same antibiotic would not be beneficial to both. Depends on the situation. Suppose, depending, if it's a young person, I will wait. If it's a diabetic person, if it's an old person, when I know, I give a second course of antibiotic again if he really has an infection.
So, ma'am, definitely it's a need of, from the clinical point of view, and we cannot ignore that because it
Exactly.
required.
The
But
same
apart from
bacteria, it could be when it's a second infection, it could be a different bacteria. So,
absolutely, yeah.
depending on the
So,
clinical, we give it.
yeah. So in such case, ma'am, there are a lot of nutrient deficiencies being happen. Person might be feeling very weak. What are your suggestions in that case for a person? What aspects person should keep in mind while going through two antibiotic course, back to back?
Yes, definitely the intake of food, spicy food, oily food, outside food, that they should definitely avoid. Take light food. And protein intake can be increased as tolerated because protein helps in healing also. Definitely, they have to take some vitamins also along with this. That would avoid the deficiencies, or the tiredness will go down, reduce comfortably, especially the protein intake. If it is increased, the tiredness comes down. The vitamins will reduce the tiredness. It will speed up the healing process. That's the thing.
Okay, ma'am. So I'm coming to the Girish sir wants more about like loose stools in use of antibiotics. So generally, like he has, I think, observed that whenever he takes antibiotics, there are a lot of loose motions. So what
Yeah.
are your suggestions in that case, like how he can take care of this loose motion?
So, see, antibiotics cause, in some people, it causes lot of abdominal bloating, belching, dyspepsia, loose stools, lot of sounds in the abdomen, which is really uncomfortable for the patient. And as I told you already, if we already know, if a patient tells that I don't tolerate antibiotics, and we have to give antibiotics. So we start probiotics, and along with that, we advise to take yogurt and some fermented food, which reduces these symptoms. Okay. And when diarrhea is there, when there is water loss, we advise them to take good amount of water, buttermilk with salt, lemon juice with salt. These things reduce the symptoms. And take for the required duration of the duration should be limited, and assess if the clinical features, if the symptoms are reducing. Based on that, the required duration only is advised. So to avoid diarrhea, it is use antibiotics only when needed. Use fermented foods, yogurt, use lemon juice with salt to avoid dehydration. Have adequate fluids. Avoid spicy, oily food, which further aggravates the condition. These are the common things you have to take care of.
Absolutely, ma'am. Ma'am, one more question, like, from, I don't know, the name has not been mentioned. Like, if the person having the antibiotics and want to consume the curd in the meal, 30 minutes gaps is enough, like, between the your antibiotic and the lunch time. What do you feel like, they can add probiotics to their lunch also? Is it comfortable like any other?
Yes, yes. With meals also, they can have the curd or the yogurt or the buttermilk. In between also, they can have. It's a continuous replenishment. Anytime
Absolutely.
they can have. And especially after meals, if they have, suppose they would have a rasam rice, sambar rice, or the spicy food. And I mean, usually they don't take even little rasam rice, and then you take curd or yogurt with it. It will be soothing. It will neutralize the acid. So that also, it reduces the acidity also, and you're replenishing the useful bacteria also along with that. So taking it anytime is okay.
Any particular vitamins like one should look for the doctor to prescribe during antibiotic course?
Any see, all vitamins have all these vitamins A, D, E, K, B complex, multivitamin it is called. It has all vitamins A, D, E, K also, and B complex, B1, B6, B12, that also, and which also has multi-minerals, iron absorption. These multi-minerals have iron, zinc, manganese. So all these are required for every day and more so during the illness. Any multivitamin is okay. And even some multivitamins also have amino acids. These are the protein building, they are required for protein synthesis. So even that is good. Multivitamin, multimineral, and with amino acids is even more better.
Absolutely, ma'am. And happens that Chandraprakash sir has a question that, sometimes it happens that he missed the dose of antibiotic. What should be, your suggestion in such case? Because it happens often with people like, because it's not a habit, they forget to take.
Yes, yes, it's quite common. First and foremost, not to miss the antibiotic. Put an alarm, tell someone in the family, in your office to remind. It's quite common with this busy work and short time. A person can miss, even though they know that they're missing it, but still they run away. They're in a hurry. It's quite common to face such a situation. But then first, don't forget antibiotic. If you have a tendency of forgetting, put a reminder in your mobiles, tell someone at home, tell someone in your office. Now, after missing one dose, okay, morning dose you forgot. The first morning dose you forgot. Now, afternoon you remember. Take the antibiotic in the afternoon. But don't take it on empty stomach. Suppose at 9 o'clock you had your breakfast. 11 o'clock you remember, array, I forgot my antibiotic. If you can eat something and take the antibiotic, fine. Otherwise, take it in the lunchtime. This is the second
So,
option. First option is not to forget. Remind someone,
absolutely.
some reminders.
I think we always think that, okay, we will be remembering it. So it's okay. It's not a habit, something a new routine, and it takes time to set, but
Yeah.
it's not a, consistent habit. So please set the reminders to be more cautious, because every antibiotic dose is very, very important and we should be missing that. And the entire course of 3 days, 4 days, or 5 days, generally it's 3 to 5 days. So please ensure that you are, regularly following it without any. And one of the very important factor which we completely, ignore, if there is any palpitation, any discomfort, anything which is abnormal, which you have not observed anyways previously while taking antibiotics, please report to the doctor immediately. Don't think that you have to go again. Reach out to the hospital, clinic, and connect with the doctor and check that do you need to discontinue with the antibiotics. Sometimes it happens that the medicines it's not suiting you. There are different chemicals composition in that which doesn't suit our body type. So please don't be hesitant and always reach out to the doctor with all these complaints. Ma'am, there is a question by one of the user that if we are not taking antibiotics, is it okay to take multivitamins?
Yes, you can take multivitamins because during infection, anyways, the absorption of nutrients and all that will be reduced, and your intake of food also will be reduced. So, if you take vitamins without antibiotics, it is okay. It is even more advisable.
Yeah. And there's one more question by Shri, which is really good. Like, we often get PAN-D with the antibiotics, the consumption of the Pantog-D. What do you feel it's really important why one has been suggested with the PAN-D before the antibiotics, and what's the role over here?
A very good question. Always
Yeah.
the prescription of a doctor will contain this PANDI or any other PPI. See, what happens is the acid production in the stomach increases during stress. So, illness is also a stress. So, acid production is increased. Secondly, the antibiotics also irritate the stomach. They also increase the acid production. Furthermore, for body pain and all this headache, body ache, certain painkillers are given, even paracetamol is given. All this will increase the acid production. Furthermore, a person cannot eat as usual. And suppose some people don't even take yogurt during cough and cold because that increases the phlegm. So there are so many reasons for acid production to increase. We anticipate these things and then we give so that the person completes the course of antibiotic. Suppose I don't give, then they start vomiting. The antibiotic will not be continued. The full duration will not be continued, and the infections may not heal. That can cause further complication. We anticipate all this and we give Panty. But of course, there are a few people who tolerate antibiotics without any PPIs. Therefore, but most of them require this Panty or whatever PPI is advised.
Thank you, ma'am. There are a couple of questions on the diet which I quickly address. What is the good time to have the curd and chia seeds? No good time. It's like just as Dr. Usha has mentioned, half an hour gap between the food and the antibiotic. That's it. Rest you can have it any time of the day. It's absolutely okay. You can have it in the mid-morning snacks also. Absolutely fine. Uh, there's one more question. Okay, what about magnesium? Which multivitamin has it? So magnesium, I think it's there in all the multivitamins, ma'am.
All the vitamins.
Yes.
All the
And we
standard
can,
vitamins has it.
yeah. And we have a lot of news, natural sources also. You have nuts, seeds, chia seeds is there. So please have all of them. They are very good source of magnesium, and you don't need to be dependent on any extra, supplement for this. So taking chia seeds with cinnamon, absolutely okay, no problem with that. And there is another question by Uma Kananan, that how to control blood pressure. It's
How
not related to
control,
diabetes, but
yes. Okay. Though it is not related, we have a question and it's for the general awareness, it's good. Blood pressure, there are multiple causes for the blood pressure to go high. We need to see what is the cause. Stress is most commonly seen. So de-stressing. What is de-stressing? Engage in an activity which gives you happiness. Maybe a sport, maybe a music, maybe a dance, maybe a meditation. These are the first common lifestyle modification. Whatever lifestyle has given high blood pressure, modify that lifestyle. And of course, secondly is the medicines, and that the doctor will check the BP consecutively, 2-3 readings they will take, and then only the medicine is indicated. Most of the time, lifestyle modification will reduce the blood pressure.
absolutely, ma'am. And this quick question by Shrikant sir, it's also not related to the topic, but it's on the diabetes medication. So whenever we are taking diabetes, now one I want you to address in general that whenever the person is taking the diabetes medicines, they also do the mistake of taking it anytime. Like, if they are missing before the food, they take it after the meals. So I want to just quickly just brief and, just that what time they should take it. And he has a question specifically with respect to the glycomet tablets. What time and what would be the duration between the glycomet and the food?
Okay. See, all tablets can cause gastric irritation. So that is why we tell to take it after food. But there are, with advanced technology, some sustained release preparations are there available in the market. They don't cause acidity for most of them. But in spite of taking these sustained release, a person is having acidity problems or gastric irritation or nausea, bloating, belching. We tell them to take it immediately after food. But in specific, all anti-diabetic medicines should be taken 15 to 30 minutes before the meals, including metformin. Metformin, especially the metformin sustained release preparation, that also can be taken before meals. But some people are so sensitive. So we don't want to take, they have such a sensitive stomach. We don't want to take chance. So usually I tell them to take it with the food or after the food. After the food is 10-15 minutes. Otherwise, all anti-diabetic medicines can be taken 15 to 30 minutes before their meals. But I usually tell 15 minutes because suppose someone gets a call or something happens and they would have forgotten that they have taken the medicine and they get engaged in the activity. And then they may go to low sugars and the acidity can increase. That is why usually I give a gap of only 15 minutes, just 15 minutes before your meals you take. Now, suppose they forget to take 15 minutes before the meals. Once in a way, it happens. It's okay. Take it after the food at least. But don't take it after 1 hour of the meals or after 2 hours of the meals. No. 15-30 minutes before food is advisable. Due to some reason you have forgotten, take it within 30 minutes of your meals. That one dose only. But again, then from next, you should take it before meals only.
Absolutely. I think that's it. There are no questions, I guess. Any other question, guys? Please put it there in the chat section. Okay, there is a question by Razia ma'am that she's on a lot of medication. How to reduce these tablets?
Yeah, these poly medicines or polypharmacy we call this quite we see commonly. We need to see what are all the medicines, what are the conditions you have. Can we reduce some medicines that after analyzing completely only we will be able to tell. Of course, we can reduce few medicines. We can make few medicines on alternate days like calcium, magnesium, vitamins. There are few things, and this omega-3 fatty acids, prebiotics, probiotics, these things are there. When there are multiple medicines, some of them we tell to take it on alternate days or once in 3 days. When there are many medicines, we need to see what is the benefit, what is the loss. Stomach should be protected. Otherwise, the vitamin deficiencies have to be taken care. All that when we speak to the patient, analyze the condition one by one, and then choose what is most required and what, of course, we can compromise a bit. Looking at this balance, we can advise and definitely we can reduce few medicines. But that requires a detailed assessment.
Absolutely, ma'am. I think, ma'am, one more question from my side. So often, people are very hesitant in taking these supplements. They feel that, okay, give us, natural food, either about proteins, being vegetarian. There are very limited sources. No matter whatever we are eating, we are not able to meet up the daily requirement. Now, there are a lot of restrictions and the mental barrier. I would like you to address it because sometimes it's very important to take these supplements because we are having a metabolic disorder where the body is not able to absorb all the nutrients through the food, and it's important to give the support of the supplement. I want you to address this query because people have that mental barrier which need to be cleared.
Yes, supplements are definitely needed. But then as you tell, some people tell we'll take it naturally. Now, for an example, I'll tell you. 1 liter of milk contains 1 gram of calcium. So now, if I have to drink 1 liter of milk every day, it becomes really difficult. I have to have food also, and I cannot stay only on 1 liter of milk to get 1 gram of calcium. So that is where we use supplements. Now, 1 liter of milk will also increase the sugar. It will also increase the cholesterol. But I don't want the sugar and cholesterol to increase. I want only the calcium. So in such a situation, taking calcium supplements will definitely help. Similarly, others also. Now, protein. A person requires, on an average, 1 gram per kg body weight of protein. A 60 kgs man will require 60 grams of protein. In Indian food, especially the vegetarian food, we hardly get 20-30 grams of protein. The remaining, how much to eat? Like 100 ml of milk will give 3 grams of protein. Again, similarly, you will be able to tell better, Neha. 100 grams of tur dal. How much protein will we get? Around 2 to 3
Around 10 grams
grams?
of
Okay. Okay. 100 gram of tur dal will give 10 grams. So remaining, if we keep on calculating like that, all the protein requirement will not be met by the food we eat. That is where the supplements come. Whatever maximum can be taken in food, take that. There is still a deficiency. For that, you need to take supplements. All the nutritional requirement cannot be covered by the food we eat. That is there. In such a situation, we have to take a supplement. Like magnesium, only when you take and you feel after you take, you will know the difference. Vitamin D supplements, vitamin B12 supplements, magnesium, okay, calcium, I told vitamin B12. Only when you take, after some time, you will know the difference. Okay, I have back pain. I've been there. This is there for me from last 6 months, 1 year. I'm living with it. Take some magnesium, take some calcium and vitamin D. See the difference. In spite of you taking, still the pain is there. See whether it requires bending and stretching. Do that and see. So combination of supplements and exercise definitely gives a better body. The work efficiency will be increased. Only when you take and see, it's not lifetime. You take, okay, now I've given you magnesium, you take it lifetime. No, take it for some time, see the difference, assess yourself. If it is helping, please continue. My advice is, yes, you require nutritional supplement because everything cannot be covered by food.
Absolutely, ma'am. So I hope you are clear with the doubts now, because see, many people have the mental barrier that why supplements, why cannot be completed, with the food itself. So these are the, some of the restrictions. It's not that we want to give you supplements, but there is a requirement. And as we age, the absorption, body's absorption capacity also decreases, and the potential to, increase the glucose uptake goes down. And it's important to take care or take the help from the supplements at this time. So please be open when your doctor says that you have to take the supplement. That means there is an urge to take it. So don't ignore it at that time. There are a couple of questions which I see, which is very, very personal. So, Dr. Usha won't be able to address it over here because she needs your complete, history for giving any advice on that basis. But I don't know, Dr. Usha, if you are able to address it here or not. Maria ma'am is asking that Magnicol is her medicine, which is like out of stock now. Any other replacement for Magnicol?
What is Magnicol? I need to see the
I am like absolutely, I've never heard about it. That's what she has
I
mentioned.
mean,
So
the thing is, they can share the picture of the strip of the tablet,
educate.
what is the composition, and we can advise them later.
Yeah. So either you can share it with the Mariam, you can share it with the coach. She can discuss with the doctor and get back to you. So please don't worry about it. For such small queries, you can reach out to the doctor through the coach if
Yes,
you're not booking the consultation.
yes.
But yes, if 3 months and your consultation is due, then definitely you need to revise on the medication. So I just want to highlight one more thing over here. We often think that, okay, the coach is helping, the numbers are coming down, and that's it. But we need to revise the medications also. So in such scenario, meeting the doctor every 3 months, it's very important. Or if your numbers are not under control, you're going through many other complications, do meet the doctor in between to see the ecosystem where SugarFit is providing you all the pillars. Like, doctor is there, coach is there, we have the fitness trainer, we have everything for you. But utilizing it and just having the dependency on the coach won't help here. Please make sure this is the balance which we have created and we have given it to you. Utilize all the facilities. It's for you, it's for your betterment. So don't ignore it. And I hope this will. Magnesium and calcium, she's saying. Magnicol is magnesium and calcium.
Calcium and calcium. Okay. See, after 40 years, it is told one calcium and magnesium combination tablet every day, lifetime. Now you get bored taking it every day. So what I usually tell is in 1 month, stop it for 5 days, or take a holiday on Sunday, drug holiday on Sunday. Otherwise, take it lifetime. And whenever we are doing the periodical lab reports, please check whether your calcium is normal, whether your magnesium is normal. And if it is normal, yes, you can take lifetime. Suppose it is high, stop it for a while and then restart it. That depends each person to person, what is the level, what is the body weight, how many days we should stop. All that we need to tighten depending upon the individual's status, the lab reports.
Absolutely. Thank you so much, Dr. Usha. I think the session was really very helpful. I hope you all agree with me, and thanks to all of you for joining us on Sunday morning. Those who wanted to understand in Hindi can stay back. I will brief quickly about the entire session in Hindi in 5 minutes. So, those who want to understand in Hindi can stay back, rest, can really leave the session. Have a wonderful Sunday. I hope you all have joined the Colorful Chapati Challenge. So, please stay tuned to it. Keep joining something, which is providing your body a lot of nourishment. We do it for you, for your better health. And I hope if you join it, you will enjoy it and see the benefit also. Thank you so much, ma'am. I think it was a wonderful session, very short, crisp, and easy to understand. It's the antibiotic awareness week, and we all should be aware how to consume it, when to consume it, in what form to consume it, what are the losses we are going through, either the nutrient loss or any other complication that we are facing, how to deal with it. I think Dr. Usha has equipped us with all these strategies, and now we are all prepared to be on antibiotics without any fear of having the loosies or having constipation. So please now bring a balance in your diet from the day one, when you know that you are going to be on the antibiotics, and what are precautions that we as an individual can take from our side. Thank you so much, Dr. Usha, for joining us today.
Thank you.
I really would like to thank you for being here with us on Sunday. I know it's your
Yeah.
weekend. So
Thank you, Neha. Thank you. Thanks,
most
everyone.
welcome.
Bye.
So those who want to understand in Hindi, please write down yes in the chat section. I will quickly take it for you in Hindi. I know some people they cannot understand English, and see, this is a very important topic. Most of the people they don't understand why we have been giving antibiotics, why we are having the loose motions, why we are going through a lot of palpitation or discomfort, whether to report it to the doctor or not. All these queries keeps on coming in our mind, and we need to focus on it. Okay, so we have a lot of people who wants to understand in Hindi also. Give me a second, I'm just sharing my screen and will quickly brief you about the entire session in Hindi. I hope my screen is visible. So when we talk about the antibiotics, there are different type of infections. हमारे बॉडी में अलग अलग तरीके के इन्फेक्शंस होते हैं, जो कि बैक्टीरियल होते हैं, वायरल होते हैं, और उसके अकॉर्डिंग हमें एंटीबायोटिक्स दी जाती है। तो जब हमें इस तरीके के एंटीबायोटिक्स दिए जाते हैं, जो कि या तो जैसे हमें बैक्टीरियल निमोनिया हो गया हो, या ट्यूबरक्लोसिस हो, या यूरिनरी ट्रैक्ट इन्फेक्शन हो जाता है कभी कभी हमें, तो इन सब के लिए अलग अलग मेडिकेशन दी जाती है, विच इज कॉल्ड, उसे क्या बोलते हैं, एंटीबायोटिक्स बोलते हैं, और वो हमें हेल्प करते हैं टू फाइट दीज इन्फेक्शंस। बट इफ वी से कि हमारे को फ्लू, जुकाम, सर्दी, खांसी के लिए कोई हमें एंटीबायोटिक देता है, तो नो, वी आर नॉट, वी डोंट नीड इट। ये तभी चाहिए होती है जब हमें किसी तरीके का इन्फेक्शन होता है, विच इज बैक्टीरियल, ट्यूबरक्लोसिस और यूरिनरी ट्रैक्ट इन्फेक्शन। अब इसमें एक चीज बहुत इंपॉर्टेंट है कि एंटीबायोटिक रेजिस्टेंस क्या होती है। तो इट्स अ प्रोसेस जहाँ पे बैक्टीरिया जो होता है वो चेंज कर देता है हमारा जेनेटिकल जो हमारा स्ट्रक्चर होता है, जिससे कि हम ससेप्टेबल हो जाते हैं, हमारी बॉडी बहुत प्रोन हो जाती है कि और इन्फेक्शंस हो जाए हमारे बॉडी में ना। इस टाइम पे हमें क्या ध्यान रखना पड़ता है कि हम बहुत ज्यादा अगर हमने बहुत ज्यादा ओवर यूज कर दिया हो एंटीबायोटिक्स का, या हमने मिस यूज किया हो, फॉर एग्जाम्पल डॉक्टर ने बोला कि 5 दिन खाना था, हमने 2 ही दिन खाया, या हमने 3 ही दिन खाया, क्योंकि 3 दिन के बाद हमें बेटर लगने लगा, हमें लगा कि हमारा इन्फेक्शन चला गया, बट इन्फेक्शन फिर भी बॉडी में रह जाता है। उसको अगर कंप्लीटली पूरे तरीके से आपको अपनी बॉडी से निकालना है, तो वो जो एक कोर्स आपको दिया गया है, भले ही वो 3 दिन का हो या वो 5 दिन का हो, आपको पूरा करना है। कभी कभी ऐसा भी होता है कि एक हमारा जो कोर्स है वो पूरा हो गया लास्ट वीक, बट उसके बाद हमें वो इन्फेक्शन फिर से रिलैप्स हो गया, या दूसरे तरीके का इन्फेक्शन हो गया, तो हमें दूसरी एंटीबायोटिक पे जाना पड़ता है। बट ये कभी कभी होता है, ऐसे ऐसे केसेस भी होते हैं। तो घबराने की कोई बात नहीं है, मेडिसिन तो हमें लेनी पड़ेगी, और उसका कोई इतना ज्यादा साइड इफेक्ट नहीं है, क्योंकि उस टाइम सबसे ज्यादा इंपॉर्टेंट हमारे लिए क्या है कि उस रेजिस्टेंस को, उस एंटीबायोटिक, उस वायरस को या बैक्टीरियल इन्फेक्शन को ट्रीट करना। इस टाइम पे छोटी छोटी बातों का ध्यान रखना बहुत जरूरी होता है। बहुत सारे न्यूट्रिएंट लॉस होते हैं, कभी डायरिया होता है, कभी कॉन्स्टिपेशन होता है, और इन सब का अगर हम ध्यान रखें तो वी कैन रिड्यूस द साइड इफेक्ट्स ऑफ एंटीबायोटिक्स। जो हमारे एंटीबायोटिक्स से बहुत सारे साइड इफेक्ट्स होते हैं, उनको कम कर सकते हैं। अगर हम ये एंटीबायोटिक्स नहीं लें तो इन्फेक्शन को ट्रीट करना बहुत मुश्किल होता है। ऐसे डॉक्टर उषा ने भी बताया कि कभी कभी क्या होता है ना, कि जो यंग लोग होते हैं उनकी इम्यूनिटी बहुत स्ट्रांग होती है, तो वो आराम से बिना मेडिसिन के, एंटीबायोटिक्स के भी रिकवर कर जाते हैं। बट कुछ कुछ ऐसे लोग होते हैं, जैसे डायबिटीज है या और कोई हेल्थ इशू है, तो क्या होता है, हमारे बॉडी में इतनी इजीली हम उस वायरस को या बैक्टीरियल इन्फेक्शन को फाइट नहीं कर पाते हैं, और वहां पे हमें इन एंटीबायोटिक्स का सहारा लेना पड़ता है, और ये जरूरी बन जाता है। ठीक है, कौन कौन से प्रिकॉशन हमें लेने चाहिए जब हम एंटीबायोटिक्स लेते हैं, तो प्लीज अपने डॉक्टर की बात सुनिए। आपको जो एंटीबायोटिक्स दी गई हैं वो ही लीजिए, अनटिल एंड अनलेस कि वो एंटीबायोटिक्स आपको कुछ साइड इफेक्ट्स दे रही हो, कि बहुत पाल्पिटेशन हो रहा है लेने के बाद, हमें हैवीनेस लग रही है, घबराहट हो रही है। तो अगर ऐसा कुछ होता है तो डेफिनेटली फिर से अपने डॉक्टर से मिलिए और वो एंटीबायोटिक चेंज कराइए, क्योंकि उसमें कुछ तो केमिकल कंपोजिशन ऐसा है जो आपको सूट नहीं करता है। तो इन बातों का ध्यान रखना बहुत जरूरी है। एंड डोसेज और ड्यूरेशन, कितना दिया गया एंटीबायोटिक, किस टाइम दिया गया है, वो लेना बहुत जरूरी है। आधे घंटे खाने से पहले अपना एंटीबायोटिक ले लीजिए, क्योंकि हमारे खाने में कैल्शियम होता है, हमारे खाने में बी कॉम्प्लेक्स होता है। तो जब हम एंटीबायोटिक्स लेते हैं ना, तो ये दोनों एब्जॉर्प्शन नहीं होने देते हैं खाने का। तो अगर एक साथ लेंगे कि भूल गए, अच्छा खाने से 2 मिनट पहले ही ले लेते हैं, तो क्या होगा, खाना एब्जॉर्ब ही नहीं होगा। आधे घंटे पहले लेंगे तो आप जो खाना खा रहे हैं उसके अंदर जो न्यूट्रिएंट्स है वो एब्जॉर्ब हो पाएंगे और आपके एंटीबायोटिक्स के साथ इंटरफेयर नहीं करेंगे, ताकि आपको कोई नुकसान ना हो और जो खाया है वो हमारे बॉडी को लगे अच्छे से। दूसरी चीज जो डॉक्टर उषा ने बताई है कि एडवाइस डोसेज, जितना भी बोला गया है उतने ही डोसेज में लीजिए, कोई भी डोसेज स्किप या अवॉइड मत करिए, या फिर पहले से ही अपने आप बंद मत कर दीजिए कोई मेडिसिन। सो एक चीज की ध्यान रखना बहुत जरूरी है कि हमें जैसे कोई डोसेज बोला गया था कि मॉर्निंग में ब्रेकफास्ट से आधे घंटे पहले लेना है, हम भूल गए, तो डॉक्टर उषा ने बताया कि आप लंच से आधे घंटे पहले ले सकते हैं, या फिर 11 बजे आप कुछ फ्रूट या कुछ खा रहे हैं तो उससे आधे घंटे पहले हम, या 11 बजे हम मेडिसिन लेके एंटीबायोटिक्स, उसके आधे घंटे बाद हम कुछ फल वगैरह कुछ खा सकते हैं। ठीक है, इसका मिसयूज मत करिए कि अभी डॉक्टर ने हमें ये एंटीबायोटिक दी थी, नेक्स्ट टाइम फिर से हमें ऐसे कुछ सिम्टम्स देखे तो हम अपने आप ले लेंगे। अपने आप नहीं लेना है, उसका साइड इफेक्ट हो सकता है। आपको नहीं पता कि कौन से टाइप का बैक्टीरिया है जो आपको अभी फिर से अटैक करा है, वो सेम बैक्टीरिया है या दूसरा बैक्टीरिया है। तो जो एंटीबायोटिक डॉक्टर देता है वो सोच समझ के, आपके सिम्टम्स को देख के, आपके टेस्ट रिपोर्ट्स को देख के फिर देते हैं। तो प्लीज उसको ध्यान में रख करके ही मेडिकेशंस लें, अपने आप से प्लीज अपने डॉक्टर ना बने, बहुत जरूरी है। ये अक्सर हम मिस्टेक कर देते हैं कि अरे छोड़ो कौन डॉक्टर के पास जाए, अभी थोड़े दिन पहले ही ये मेडिसिन दी थी और यही खा लेते हैं। तो ये नहीं करना है, और जो लेफ्ट ओवर मेडिसिन है या एंटीबायोटिक्स है उसको फिर से यूज करना इज ऑल्सो रॉन्ग। आपका जो कोर्स है वो तभी इफेक्टिव होता है कि जब आप उसको एक निरंतर ड्यूरेशन में ले रहे हो। ठीक है, बहुत जरूरी है कि हमारे जब भी हम एंटीबायोटिक्स पे होते हैं तो हमारे पेट में ना बहुत सारी प्रॉब्लम्स हो जाती हैं। तो एंटीबायोटिक्स क्या करती हैं, वो तो आपके बैक्टीरिया को या वायरस को आपके मार रहे हैं, लेकिन उसको नहीं पता ना कि आपके गट लाइनिंग्स में क्या है। तो आपके जो गट, आपका जो स्टमक होता है उसके ऊपर एक प्रोटेक्टिव लेयर होती है, वो उसको भी खराब कर देती है। उसकी वजह से जो आप खाना खा रहे हैं वो बॉडी में एब्सॉर्ब नहीं होता, क्योंकि सारा खाना कहाँ एब्सॉर्ब होता है, हमारे पेट में होता है। तो अगर आप एंटीबायोटिक्स पे है तो बहुत नॉर्मल चीज है कि आपके गट की लाइनिंग जो है वो खराब होती है, और बाहर के एसिड्स अंदर आते हैं पेट में, और पेट के जो हमारे गैस्ट्रिक जूसेस हैं वो बाहर चले जाते हैं, वो बैलेंस बिगड़ जाता है। इससे क्या होता है कि खाना एब्जॉर्ब नहीं हो रहा है, एसिडिटी हो रही है, इंडाइजेशन हो रहा है, भारीपन लग रहा है, ऐसे या चक्कर आने, डिजीनेस होना, ये बहुत कॉमन है। प्रिकॉशंस क्या लेने होते हैं कि हम थोड़ा फर्मेंटेड फूड ले लें, इडली वगैरह ले लीजिए, राइस ले लीजिए, राइस कर्ड राइस है, और दही है, रसम वगैरह है, हमारे यहाँ नॉर्थ में कांजी बनती है, बीट रूट कांजी वगैरह ले लीजिए, ताकि हम वापस से अपने गट को फिक्स कर पाए। तो जहां पे एंटीबायोटिक्स लेना जरूरी है, लेकिन साथ ब साथ अगर आप इन छोटी छोटी बातों का ध्यान रखते हैं तो आपको आगे जाकर के कोई भी डिस्कम्फर्ट लाइक वीकनेस होती है, हमारे बहुत सारे न्यूट्रिएंट्स होते हैं, बी कॉम्प्लेक्स होते हैं, मैग्नीशियम होता है, ये सब हमारे बॉडी से फ्लश होने शुरू हो जाते हैं जब भी हमें कोई बीमारी होती है। हमारी बॉडी कैसे फ्लश करती है इन सब बैक्टीरियाज को या वायरस को, थ्रू यूरिन या फिर फीकल रूट। हाँ, तो हमें क्या करना है, हमें केयरफुल रहना है कि हम खूब सारा पानी पिए, अपने आप को हाइड्रेटेड रखें, जितना हाइड्रेटेड रखेंगे, इलेक्ट्रोलाइट्स लेंगे, उतना ज्यादा बॉडी से फ्लश होता रहेगा। बट इस फ्लश होने के टाइम पे बॉडी को नहीं पता कि वायरस और बैक्टीरिया के साथ साथ हमारे अच्छे न्यूट्रिएंट्स जो है जो हमारे बॉडी को चाहिए वो भी फ्लश हो जाते हैं। तो इस टाइम पे थोड़ा एक्स्ट्रा न्यूट्रिशन की जरूरत पड़ती है, इसीलिए आपके डॉक्टर्स आपको सप्लीमेंट्स देते हैं, मल्टीविटामिन डॉक्टर उषा ने बताया कि हम ले सकते हैं। बट अवॉइड करिए एंटीबायोटिक का ओवरडोज, बिकॉज बहुत ज्यादा आप अगर ले लेते हैं तो इसके और भी बहुत सारे नुकसान है। और बैक्टीरिया भी जो है वो रेजिस्टेंट बन जाता है, बार बार ले रहे हैं तो क्या होता है, वो बैक्टीरिया उसको रिएक्ट करना बंद कर देता है। तो इसलिए इम्पोर्टेंट है कि आप उसे एक डिफाइंड डोसेज में ही लीजिए, जितना आपके डॉक्टर ने बताया उस फ्रीक्वेंसी में लीजिए, एक पर्टिकुलर गैप दे के लीजिए। और दूसरे टाइम अगर इन्फेक्शन फिर से हो रहा है तो डॉक्टर से मिल करके उनसे पूछ करके लीजिएगा, अपने आप से मत लीजिएगा। इसके कॉमन साइड इफेक्ट्स क्या होते हैं एंटीबायोटिक्स के? एलर्जी हो जाती है, डायरिया हो जाता है, कभी कभी गला जलना, क्योंकि मैग्नीशियम कम होगा तो आपके बॉडी के जो एसिड्स होते हैं ना उसको मेंटेन करके रखता है मैग्नीशियम। तो आपका क्या हो रहा है कि एसिडिटी बढ़ रही है बहुत ज्यादा, हार्ट बर्न हो रहा है, या आपको पाल्पिटेशन हो रहे हैं, तो ये सारे इसकी कॉमन साइड इफेक्ट्स हैं। अगर बहुत ज्यादा एक्सेसिव हो रहे हैं और आपको तंग कर रहे हैं तो प्लीज डॉक्टर से मिल करके ये अपनी मेडिसिन चेंज करा लीजिए। पर अगर बियरेबल है तो मेक श्योर कि आपका मैग्नीशियम अच्छा हो। मैग्नीशियम कहाँ से आता है? छोटी सी चीज बताती हूँ, पानी के अंदर चिया सीड्स डाल दीजिए, बहुत सारा मैग्नीशियम आ जाता है, इलेक्ट्रोलाइट्स आ जाते हैं, तो हमारी बॉडी में जो ये सब साइड इफेक्ट्स हो रहे हैं ना ये नहीं होते हैं। दूसरी चीज, छोटी सी हरी इलायची आती है वो मुंह में डाल लीजिए, उसमें भी बहुत सारा मैग्नीशियम होता है, तो आपके बॉडी के एसिड लेवल्स मेंटेन रखती है। 4-6 इलायची छोटी वाली लेके पानी में उबाल करके थोड़ा नॉर्मल टेम्परेचर पे आ जाए तो उसको पीते रहिए, तो आपके एसिड्स बढ़ेंगे नहीं, क्योंकि गट की लाइनिंग खराब हो गई है तो बाहर का एसिड अंदर आ रहा है, अंदर के गैस्ट्रिक जूसेस बाहर जा रहे हैं, तो सब कुछ जो है बिल्कुल टॉपसी टर्वी हुआ हुआ है। तो हमें इधर छोटी छोटी चीजों की बारीकियों का ध्यान रखना होगा, अगर रखेंगे तो कोई प्रॉब्लम नहीं होगी। बाहरी खाना मत खाइए, स्पाइसी मत खाइए, बहुत तेल तला हुआ मत खाइए। आप जितना आपके जब गट डिसबायोसिस हो जाती है ना, ये लाइनिंग खराब हो जाती है प्रोटेक्टिव लेयर, तो क्या होता है ना, बॉडी को सब गंदी चीजें खाने का मन करता है, मन करता है कुछ स्पाइसी खा लें, कुछ हैवी खा लें, पर डाइजेस्ट तब भी नहीं हो रहा है हैवी, उसके बाद और हमें खराब ही लग रहा है। लेकिन अगर आप उसको ध्यान में रखें कि अच्छा ठीक है हमारे गट की वजह से हो रहा है, लेकिन हम अपना खाना खिचड़ी या पतला सॉफ्ट फूड ही खाएंगे, पतला सा बटर मिल्क बना के ले लेंगे या प्रोबायोटिक्स ले लेंगे, तो आप देखिएगा आपको कोई प्रॉब्लम नहीं होगी। तो दैट्स ऑल अबाउट द सेशन। छोटी छोटी चीजें मैंने बताई थी कि गट डिस्ट्रक्शन हो जाता है, उसके लिए बहुत सारे वाइटामिन होते हैं जो हमारे बॉडी से डिप्लीट हो जाते हैं। के हो जा विटामिन के डिप्लीट होता है, बायोटिन डिप्लीट होता है, इसलिए आपने देखा होगी कभी बीमारी होती है ना, बाल झड़ने लगते हैं, फोलेट कम हो जाता है। दीज आर ऑल वेरी इंपॉर्टेंट फॉर योर हेयर। और सबसे सेंसिटिव हमारे बॉडी का पार्ट क्या होता है? हेयर होता है। तो सबसे पहले बाल झड़ते हैं। इसीलिए अगर आप बी कॉम्प्लेक्स या मल्टीविटामिन ले रहे हैं उस टाइम पे, और आप अपने खाने का ध्यान दे रहे हैं कि आप सिंपल खाना खा रहे हैं, पानी अच्छे से पी रहे हैं, उसमें चिया सीड्स वगैरह डाल रहे हैं, सूप ले रहे हैं उसमें थाइम, रोजमेरी, ऐसे थोड़े से हर्ब्स डाल दीजिए, तुलसी का पानी है, ये सब आपके न्यूट्रिएंट लॉस को थोड़ा प्रिवेंट करता है, साथ में आपके बॉडी को एल्कलाइन रखता है, और ये जो हेयर फॉल वगैरह की प्रॉब्लम होती है नहीं होती है। तो जितना भी आपका न्यूट्रिएंट एब्जॉर्प्शन नहीं हो रहा है गट लाइनिंग के खराब होने की वजह से, सो मेक श्योर कि आप अपने खाने में खूब सारा मैग्नीशियम रिच फूड डाल रहे हैं। इससे मिलता है, मोरिंगा पाउडर से मिल जाता है, मोरिंगा लीव से मिल जाता है, जो ड्रम स्टिक लीव्स होती हैं, सहजन के पत्ते बोलते हैं उसको हम नॉर्थ में, आपको आसानी से मिल जाते हैं, आप वो ले लीजिए। कच्ची हल्दी आ रही है मार्केट में, अब सर्दी शुरू होने वाली है, कच्ची हल्दी लीजिए पानी में उबाल करके। आप गुआवा खा सकते हैं, आप बहुत सारे कैल्शियम रिच सोर्सेज आपके जैसे सेसमे सीड्स है, तिल होते हैं, तिल वगैरह खा लीजिए तो आपको आयरन और आपका कैल्शियम ये सब लेवल कम नहीं होगा। कीवी है, बहुत अच्छा सोर्स है आयरन का, जिंक का। तो ये छोटी छोटी चीजों का आप ध्यान रख लीजिए तो आपको कोई प्रॉब्लम नहीं होगी। सो बेसिकली यही सारी चीजें हमने अभी डिस्कस करी थी अभी पूरे सेशन में, कि ये सारी खाने की चीजें आप खाना और मेडिसिन के बीच में आधे घंटे का गैप रखिए, खाने में सॉफ्ट फूड लीजिए जब भी एंटीबायोटिक्स पे हैं, चाहे कितना भी मन करे भारी खाना मत खाइए, बिकॉज खा लेंगे फिर उसके बाद और बुरा हाल होगा। वीकनेस कम करनी है, इलेक्ट्रोलाइट्स बना के रखिए, एक वाटर बॉटल लीजिए, इस वाटर बॉटल में आप अपना जैसे कुछ भी डाल लीजिए, अपना चिया सीड्स डाल लीजिए, हल्का सा काला नमक डाल दिया एक चुटकी, थोड़े से बेसल सीड्स या तुलसी के पत्ते डाल दिए, बस इतना ही करना है। थोड़ा सा काम हम कर लेंगे तो आई थिंक ये जो वीकनेस होती है, इतने सारे जो न्यूट्रिएंट्स हम खाना खा रहे हैं और हमारे यूरिन के थ्रू या फीकल रूट के थ्रू फ्लश हुए जा रहे हैं, उनको हम सेव कर सकते हैं। यस आई गेस मैंने सब कुछ कवर कर लिया है, और अगर कोई और डाउट है तो प्लीज मुझे जरूर बताइएगा। और ये सेशंस हर संडे होते हैं तो प्लीज डू ज्वाइन। मत मिस करा करिए। आई होप ये छोटी छोटी इन्फॉर्मेशन है जो हम हर दिन अपने कोच के साथ डिस्कस नहीं कर पाते, बट हम यहाँ इन सेशंस में डिस्कस कर सकते हैं। थैंक यू सो मच फॉर ज्वाइनिंग, और आप सभी को हैप्पी संडे मेरी तरफ से। कोई भी सजेशन हो तो आप प्रीमियम ग्रुप पे लिख सकते हैं। लिस्ट ऑफ मेडिसिन कैन यू आस्क डॉक्टर जी हाउ टू डू। मैं आपको एक सेशन का लिंक दे रही हूँ। यहाँ पे एक शुगर फिट का ना हमने चैनल स्टार्ट किया था, जिसमें सारे वीकेंड वेबिनार के रिकॉर्डिंग्स हैं। आप ये रिकॉर्डिंग्स सुन लीजिए। आप डॉक्टर छवि के सेशंस हैं, बहुत सारे हैं, आपको सारी डिटेल्स मिल जाएंगी। और ये यहाँ पे सारे हमने ना सेव करके रखे हैं कि आपको आगे जाकर के कुछ समस्या ना हो, कभी भी मन करे सुनने का, पता नहीं याद आ रहा है कि क्या बोला था डॉक्टर छवि ने, नहीं ध्यान रहता है, तो वापस से आप जितना देखते रहेंगे ज्यादा आपके कॉन्सेप्ट्स क्लियर होंगे, उतनी आसानी से आप इन सब चीजों को ध्यान में रख पाएंगे। मैं ये सारे सेशंस का आपको एक लिंक भेज दे रही हूँ, आप इसको सब्सक्राइब कर लीजिए, और जब जब मैं रिकॉर्डिंग आपको अपलोड करूंगी आपको मिल जाएंगी सारी डिटेल्स। आप लोग ओपन करके इसको सेव कर लीजिएगा। Don't worry, Terence. I'm going to share the recording. If you just check here in the chat box, I have shared the link for the recorded sessions. All the webinars recording will be available over there. There are a lot of short recipe videos, short information also, whatever I'm sharing on the premium group. Please stay tuned to this. You can keep a check on these webinars, because a lot of information which is very important for us, which nobody shares. Even the coach cannot talk all about this, but if you are keeping a check or listening to these webinar, which is like 30 minutes of the information and rest 30 minutes is the question answer, would be a great learning. वी ऑल लिसन टू लॉट ऑफ पॉडकास्ट, बहुत सारे पॉडकास्ट सुनते हैं हम, बहुत सारे अलग चीजें, कभी कभी इंस्टा ही स्क्रॉल करते रहते हैं जिससे हमें कुछ सीखने को नहीं मिल रहा है। बट अपनी बीमारी को, अंदर जो प्रॉब्लम है उसको जितना ज्यादा समझेंगे, उतनी आसानी से आप इन समस्याओं का हल ढूंढ पाएंगे। सो प्लीज इसका आप थोड़ा ध्यान रखिए। प्रीमियम ग्रुप पे मैं रोज ही एक्टिव होती हूँ, तो प्लीज आप वहां पे मुझे टैग कर सकते हैं @नेहा कपूर, और आपकी जो भी क्वेरीज है मैं आंसर कर दूंगी। अपने पिक्चर्स प्लीज वहां जरूर शेयर करा करिए, आपके रीडिंग्स कितने आ रहे हैं। अच्छा लगता है एक दूसरे का जर्नी देख करके, कि एक थोड़ा इंस्पिरेशन मिलता है कि हाँ ये भी कर रहे हैं तो हम भी कर सकते हैं, ऐसा नहीं है कि हम नहीं कर सकते। और थोड़ा एक सपोर्ट भी मिलता है कि हम अकेले नहीं है इस जर्नी में। बहुत खराब लगता है कि अरे हमें क्यों डायबिटीज हो गया, बट ये शरीर है ना, हमें किसी का भी हमारा इस पे कंट्रोल नहीं है। तो अगर आप चाहते हैं कि आगे जा करके आप सब एक दूसरे का सपोर्ट बने रहें और हम सब आपको इसी तरह से गाइड करते रहें, तो प्लीज प्रीमियम ग्रुप पे एक्टिव रहा करिए। छोटे छोटे क्विज देती रहती हूँ मैं, उससे भी बहुत कुछ सीखने को मिलता है। प्लीज वो सब क्विज अटेम्प्ट करा करिए। ज्यादा से ज्यादा क्या होगा, गलती तो आ जाएगा आंसर, बट गलत के बाद भी हम सीख सकते हैं। ठीक है। थैंक यू सो मच फॉर द फॉर ज्वाइनिंग द सेशन। हैव अ वंडरफुल डे। हाँ सारा जी, आप प्लीज पैथिक डॉक्टर को, या बेटर है कि किसी या न्यूरोपैथ को मिल ही लीजिए, बिकॉज व्हाट इज द इशू ही विल बी एबल टू डायग्नोज बेटर। आप मिल लीजिए। थैंक यू एवरीवन, थैंक यू वर्दा मैम, Thank you, Meenu ji. Thank you, everyone. Shivam, thank you. Sorry, I couldn't take your question. It's a personal question which your doctor can address. So please अपने coach को बोलिएगा, वो जरूर बता देगी पूछ करके। चंद्र प्रकाश sir, thank you. So thank you, everyone. Have a wonderful day. I also have consultation, so we'll be moving ahead. I hope to see you all there in the premium group. So let's keep, keep ourselves more active over there. Bye bye.